Hello friends, I am Dr. Trupti Kharosekar, gynecologist and fertility consultant at Curate Hospital and IVF Center, Thane. Hope you and your family members are at home and taking adequate precautions to keep the COVID-19 infection at bay. Friends, while in the lockdown period, we've had the pleasure of enjoying various mythological series, Mahabharata being one of the most noteworthy amongst them. Why do I mention it? To highlight and stress upon the fact that Raja Dashrath could father 100 sons or 102 children to be precise in the epic. So if fertility in men was so high in the epic era, is declining male fertility seen in recent times a reality? Unfortunately, yes, it is. Studies have shown a significant reduction in male semen parameters in the growing years. So let us today have a closer look at and try to understand the various aspects of male infertility. Infertility is the inability of a couple to conceive in spite of 1 year of trying. Nearly 1 in 8 couples face trouble having babies. Though both male and female partners might be responsible for the reproductive challenges, male factor itself contributes to nearly 1/3 or 30% of the total causes, and another 20% in conjunction with the female factors, which makes it a total of 50%. The number is significant. To get a better understanding of male infertility, let me brief you about the reproductive system of men. The male reproductive system consists of the testicles, where production of human gamete sperm takes place, which is called spermatogenesis. The epididymis, which is the storehouse where sperm are stored before they attain maturity, and a network of microtubular structures, which is nothing but tiny pipes which carry the sperm from epididymis after maturation into the semen during the act of ejaculation. Certain areas in the brain secrete hormones which then act upon the male reproductive system and initiates spermatogenesis. The production starts around puberty. Though most men may produce millions of new sperm each day, you'll be surprised to know that each sperm takes about 72 to 74 days on an average to become mature enough to fertilize a female egg. It is a lengthy process and hence damage can occur at various levels. 3 important parameters which determine sperm function are the number of sperm in the semen, motility, that is the number of actively motile or highly forward-moving sperm in the semen, and morphology, that is the number of normal shaped sperm in the semen sample. According to World Health Organization or WHO, a sample containing more than 15 million sperm per ml of semen, motility of more than 40% and a morphology of more than 4% is considered normal. So now what causes decline of fertility in men? Well, a detailed and in-depth discussion of the various causes of male infertility may be out of the purview of the present discussion. But broadly, we can categorize them into 6 groups. Hormonal factors, where there is an imbalance of hormones leading to effect in spermatogenesis. Anatomic factors, where the formation or transport of sperm is affected. Lifestyle factors like obesity, being overweight, smoking, alcohol, stress, diabetes, etc. Infections of the male genital tract are an important cause, especially because if detected early, they can be treated, otherwise can cause permanent damage and scarring. Genetic factors, which are rare but a significant cause of male infertility. And a miscellaneous group, like history of childhood trauma, childhood malignancies, history of intake of certain medications, etc. How do we evaluate for male infertility? A careful history and a thorough examination by a urologist or an andrologist may help us find the various causes of male infertility in a particular couple. Certain blood tests might be required to know the hormonal levels as well as to detect certain diseases like diabetes, thyroid problems, etc. Ultrasound or sonography might be required in a very small percentage of patients to know if there are any anatomical problems. The most important diagnostic tool to know the male fertility status is a semen analysis. In semen analysis, the patient is required to give a semen sample in a sterile container in the private clinic of a doctor. It is then examined in the laboratory for various parameters like count, motility, morphology, etc. An abstinence period of 3 to 4 days is considered optimal before you give a sample of semen for testing. Now, some men might be uncomfortable or embarrassed to give a semen sample outside the privacy of your bedroom. But people, you need to understand, if you have a blood problem, you do a blood test. If you have a urinary problem, you do a urine test. Similarly, if you have a fertility problem, you do a semen test. So it's nothing to be anxious about. Now, is male factor infertility amenable to treatment? The good news is yes. To a certain extent, your andrologist or fertility expert will help take care of certain factors causing infertility in you. There are certain lifestyle modifications which you can adapt to improve your reproductive health. Keep your sugars in check if you are a diabetic. Stop smoking. Limit the alcohol intake. Exercise in moderation is good for your sperm. 30 to 45 minutes of exercise per day for 5 days a week is considered optimal. Strenuous exercise, though, can be detrimental to sperm health. Avoid the use of over-the-counter muscle-building supplements, which is the abuse of which is very, very common among gym trainers. These supplements contain testosterone, which can hamper your ability to father. We've discussed in the previous talk in detail how diet affects our reproductive health. So increase the intake of green leafy vegetables, fruits, whole grains, nuts, egg, fish, etc. in your diet. Try and grab at least 6 to 8 hours of sleep each day. High amounts of heat are not good for sperm health. Hence, hot water baths, saunas, handling of laptops on the lap instead of a tabletop or desk can be detrimental to your sperms and are not advised when you're planning pregnancy. In spite of medicines and lifestyle modification, a small proportion of patients who have borderline semen parameters like around 10 to 20 million per ml of semen might require certain other forms of treatment like IUI, which is intrauterine insemination. During IUI, the male partner produces semen sample which is then processed and the highly motile sperm are pushed into the uterus or womb of the female partner through a tiny catheter to achieve conception. In a very small percentage of patients where the semen parameters are severely compromised, they might need advanced forms of treatment of IVF like ICSI, TISA, etc. Now let us address the most important aspect of male infertility: stress. Psychogenic stress can be a cause as well as the effect of male infertility. As a cause, it is important because it disturbs your hormonal balance, which can result in abnormal sperm production as well as cause problems with erection. As an effect, stress has a huge impact on men. Every man wants to father children and experience fatherhood. In a male-dominated society like in the Indian culture, parenthood or fertility is considered equal to masculinity. There is a huge stigma around male infertility which can result in shattering of self-esteem, feeling of guilt, depression, anxiety disorders. This increases the marital discord and hence makes conception even more difficult. Friends, we need to understand that fertility issues in men are complex and require a multidisciplinary approach involving the urologist or andrologist, the fertility expert and the counselor. Couples are quite reserved when it comes to discussing reproductive health issues with their healthcare professionals, and especially when it concerns the male partner. And this makes them refrain from treatment. But you need to understand that just worrying and not acting does not take away tomorrow's problems. It just takes away today's peace. So my advice to all the men out there who are struggling with fertility issues: It's about time you see your fertility expert and begin your journey of fatherhood. Thank you. Take care.